Ontario NDP leader Marit Stiles is in Liberty Village this morning making a campaign announcement alongside the Ontario Nurses Association. Let's listen in live.
And maybe that's why he quit. And let me tell you, like so many of the folks who are here today who work in the healthcare system, but, I myself, like so many of you, the last 2 years, both of my parents ended up in hospital for various reasons at various points. And I've spent, many hours in emergency rooms with my daughter, with my parents, listening to healthcare workers. They talk a lot, registered nurses talk a lot about the moral distress that they feel at not being able to provide the care that they are trained to provide and that they want to provide to their patients. You've heard about the burnout that they're experiencing. I've seen that firsthand. I've heard that directly from nurses in the emergency rooms, caring for my parents when they needed it most. We owe it to nurses. We owe it to our healthcare system, and we owe it to all Ontarians to fix this. What Ontario needs is a premier that is on your side with a plan to fix this crisis. I will make sure that healthcare workers get the respect they deserve with a fair wage and safe working condition. And I'm going to bring in nurse-to-patient ratios to stop burnout and deliver better care for people. As Premier, I'll make sure that you get the healthcare you need, where you need it, and when you need it, because I'm on your side. And I think with that, we're happy to take questions.
All right. For those on the line, please press *1 to get in the question lineup. Good morning, Émilie Goujon-Pelletier with Le Droit. My question is actually for Erin.
Oh, please.
To be clear, is this an ONA endorsement for the NDP?
ONA is constitutionally nonpartisan. What we're here today to show is that there has been a commitment by the NDP to nurses and to healthcare professionals. We saw that with the drafting of the nurse-to-patient ratio bill. And we're happy to have the NDP with us today to emphasize their commitment.
And I understand, you've made it pretty clear why you wouldn't be endorsing Doug Ford's PCs, but why not choose the Liberals, for example, to support, which has been centering healthcare and patients and healthcare workers throughout their whole campaign?
I'd be happy to speak to the Liberals if they were looking to table a bill to promote this.
Hello, can I move this thing? Yeah. Sorry, I just might need a nurse myself. Marit, in terms of ending the reliance on private for-profit nursing agencies, I understand that some nurses quite like working for these agencies because they can achieve better work-life balance, flexibility, and much higher pay in some cases. So I'm just wondering if you can elaborate a bit on how exactly your party would reduce reliance on these agencies without negatively impacting the workforce itself.
Yeah, absolutely. Well, and this is one of the reasons why nurse-patient ratios are so critical to this conversation about how we fix our healthcare system going forward and how we stop the burnout and also, frankly, the bleeding, the hemorrhaging of healthcare dollars into these for-profit private agencies that I will say also have a lot of connections, insider connections to the Ford Conservative government. So first of all, nursing agencies, private nursing agencies are costing people of Ontario hundreds of millions of dollars a year. The way we get back to where we need to be is we bring in nurse-patient ratios, but we also use that hundreds of millions of dollars to hire more nurses, to take the pressure off of individual nurses. We give them in that situation then more choice, more flexibility. We ensure that they're being paid decently. We respect them. Here's another thing. We don't take them to court to suppress their wages. Let's start there. But I think it's really, those are the key components, right? We've seen this happening because, yes, it is hard to be a nurse, a registered nurse in the province of Ontario right now in our hospitals. So let's make sure that we redirect those hundreds of millions of dollars into making the working conditions of nurses in our public hospitals and our public healthcare system safer and better.
All right, and Ontario health data shows that since 2020 and up until at least August of last year, that at least 10% of patients with highly aggressive cancers waited more than double the province's recommended time for surgery. So you've promised to create a centralized waitlist for specialist treatment, but what more would you do to cut surgical waitlists?
Yeah, so, we'll be talking more about some of the details of that plan as we go forward. But absolutely, I mean, that's a key component of that is a central referral system, right? So we've already talked about addressing the physician shortage, the family doctor shortage, building and investing in our health teams. We're talking about a central referring system. We're talking now about nurse-patient ratios. These are all critical components to getting Ontario back on track, to making sure people get the care that they need when and where they need it.
Thanks. Jordan with the Canadian Press.
Hi.
I'm wondering if you could answer, Ontario is already tens of thousands of nurses short. How many more do you think we'll need to meet these ratios that are being put forward today? And where will they come from?
Well, I can tell you, first of all, what our commitment will amount to. And again, I just want to reinforce our currently what we are seeing is nurses are leaving because of burnout, because of that lack of respect by this government, and you heard it. I mean, the hospital CEOs as well, right? So bringing in staff to patient ratios or nurse to patient ratios is a critical component to restoring better life balance, better conditions to ensure that patients are treated properly, that nurses don't burn out, and that they have safe working conditions. If you look at our plan, our initial commitment is 15,000 nurses over 3 years at a cost of about $1.5 billion over that 3-year period.
This is shifting gears slightly, a question from my colleague at Queen's Park. A young beluga was euthanized at Marineland last week. It's the 18th beluga to die at the park since late 2019. Marineland is trying to sell the park, and it's unclear what will happen to those animals. What would your government, if you were elected, do to help the animals?
Yeah, I mean, this has been going on far too long. It's outrageous. It's an embarrassment, I think, for Ontario. And I've said before, and my colleague Wayne Gates in Niagara has spoken out about the need for the government to intervene here. I think Marineland needed to be shut down, and we need to get these mammals out of that, or at least make sure that they're treated at this point in their lives humanely. We cannot just continue to wait it out till they all die. It's really inhumane, and I think a lot of Ontarians are very concerned about it.
Thank you. Thank you.
All right, thank you very much, everybody. Happy Monday.
Yes.
Thanks, Aaron. It's so good to see you. Thank you so much.
We've been listening into NDP leader Marit Stiles along with the Ontario Nurses Association really making an announcement about health care and reiterating her commitment to a proper nurse-to-patient ratio. She says that the current government is leaving nurses burned out, feeling disrespected, and they're leaving in droves. Also recommitting to 15,000 new nurses over 3 years at a cost of $1.5 billion.